that, let me introduce Kim Kitters. As you know, our mental health series on the first Monday of each month focuses on a wide variety of topics in the mental health field. And Kim is kind of a boots on the ground presentation today. So she is a part of the Ecker Center, which is out in the western suburbs, think Elgin, West Chicago, that area. And they have a partnership with the Elgin Police Department for first responders going to emergency situations where mental health may be a factor in what's precipitating the event, a topic that has been covered widely in the news, but Kim has firsthand experience. So I'm going to turn it over to you, Kim.
All right, thank you. I just wanted to make sure, can everyone see my slides?
Yes, you're on.
Okay,
Yep.
perfect. So again, thank you so much for having me today. I'm here to talk about crisis support, specifically what Ecker Center provides for Elgin and the surrounding communities. A little bit about my background is I currently oversee three of our five crisis programs here at Ecker Center. And I have experience navigating behavioral health crises in hospital, residential, police, and community-based settings. All right, so a little bit about Ecker Center for Behavioral Health. We are a community-based behavioral health provider serving Elgin and the surrounding areas. We follow a certified community behavioral health clinic or CCBHC model, meaning we provide comprehensive and integrated mental health and substance use services. This can include individual therapy, couples therapy, family therapy, group therapy, case management, residential and crisis services. Here at Ecker, we serve anyone of children ages 4 and up, adults and their families, and we are committed to providing accessible, affordable, and person-centered care for any of the individuals that we serve. All right. And so, why does behavioral health crisis matter? A crisis can impact everyone, um, including, the person themselves, their family, schools, providers, workplaces, and first responders. Typically, when we think of a mental health crisis, we often call 911 or feel that someone should go to the local emergency room. However, this can sometimes cause strain to these systems as not all behavioral health crises require law enforcement and hospital involvement. With the assistance of mental health crisis programs, this can strengthen community safety and reduce an individual to experience further crises while being connected to long-term providers. Those providers can include therapy groups and as well as medication management. All right. And so typically, a behavioral health crisis is when there's a sudden disturbance in thoughts, mood, or behavior requiring immediate support. Um, this can often feel like when daily life feels unmanageable or there's a potential risk of harm. This can include um, challenges with completing daily tasks, such as going to school, work, or keeping up with your home, challenges related to maintaining hygiene, eating or sleeping, sudden onset of intense mood changes or trouble focusing, or depression or anxiety. Here, potentially hearing or seeing something that may not be there, experiencing thoughts or harming themselves, thoughts of ending their life or having thoughts of suicide or significantly wanting to harm somebody else. So here at Ecker, we have 5 crisis programs that include also, in addition to that, we provide ongoing care coordination and follow-up in some of those programs, including our mobile crisis response team, our crisis stabilization program, and our collaborative crisis services unit. And we also have a 24/7 crisis line. Um, some people know it as 888 Ecker 50. You can also access it through 888-325-3750. Um, in addition, we have our crisis residential program, which provides short-term stabilization. Our collaborative crisis services unit, which is a partnership with Elgin Police Department. Our mobile crisis response team that provides community-based intervention. So that could be in somebody's home, in the anywhere in the community, or even at Ecker Center. We also have our crisis stabilization program, which provides 24/7 walk-in support for anyone over the age of 18. And then our psychiatric emergency program, which is a team of crisis counselors that are embedded in Sherman Hospital's emergency room. So, how do people access crisis services? Um, Here at Ecker, people can access those services through our 24/7 crisis line. Um, We also can have folks come in on a walk-in basis to our crisis stabilization program, or our mobile crisis response team can also meet with individuals on a walk-in basis. Um, Regardless of if you walk into Ecker Center for crisis support or call our crisis line, it is a free service and is available to anyone of all ages, regardless of insurance. People can contact our crisis line, including the individual that's experiencing a crisis, loved ones, providers, and first responders as well. Our walk-in crisis services are supported, as I said, from our mobile crisis response team as well as our crisis stabilization program. And we do, as I mentioned before, we have other programs, including that provide psychiatric support at Sherman Hospital's emergency department as well as Elgin Police Department. So our crisis line is operated by our mobile crisis response team, and that is conducted of crisis counselors and recovery and engagement specialists. And our recovery and engagement specialists are individuals who have their own lived experience with mental health or substance use recovery and utilize their lived experience when speaking to individuals that are in crisis as appropriate. Our crisis line, the goal is to provide immediate de-escalation and crisis support. It can also deploy our mobile crisis response team if appropriate. And again, this is accessible regardless of ability to pay and provide support to all ages. Our mobile crisis response team, as I've mentioned, provides in-person and telephonic support through our 24/7 crisis line. Um, they, when they respond, they can respond anywhere. So it could be at somebody's home, school. They've responded to hospital like waiting rooms, and public locations, including like a library, police department. They could meet with someone at a park or like in a Walgreens parking lot. Sometimes they have met with people at like a local McDonald's or other establishment where it is easier for us to meet with someone if they don't feel comfortable meeting in their home. We collaborate with law enforcement as well as first responders. They can receive uh, referrals through 911 as well as 988, in addition to the individual themselves that's experiencing a crisis, loved ones, providers, and really like anyone who calls our crisis line. We will try to provide support as much as we can. Our mobile crisis response team, the services include conducting a risk assessment, providing de-escalation to the current crisis, completing a safety plan, and completing follow-up for up to 30 days post-crisis intervention. And the goal of our follow-up is to help connect people to different types of care in order to help reduce their crisis. Next is our crisis stabilization program. Um, this program is one where somebody would walk in for crisis support. So that is located at Ecker Center in Elgin, and that can be accessed 24/7. And the goal of this program is to provide short-term stabilization services for anyone who is of the age 18 or older, regardless of insurance. The goal is to provide risk assessment, brief therapy, treatment planning, short-term case management, and further safety planning. And CSP also provides follow-up support to assist in further connection to care. Individuals who participate in the crisis stabilization program, they can stay up to 23 hours of support. However, it depends based on like a clinical determination that would be made up from the crisis counselor or the recovery and engagement specialist conducting the assessments. Our crisis residential program is a program that provides a structured 24/7 therapeutic environment for up to 3 weeks. Our CRP program serves individuals 18 or over who have Medicaid for insurance. This, our crisis residential program, the services include medication stabilization, skill building, and transition planning for ongoing care. This is completed through attending daily groups, meeting with a psychiatrist, and receiving case management support. Our collaborative crisis services unit is made up of crisis counselors that provide crisis support through a partnership with the Elgin Police Department. The team provides a co-response model where a crisis counselor and a police officer respond to 911 calls together. The CCSU team provides risk assessments, de-escalation, safety planning, as well as follow-up, and they will meet with anyone of any age, regardless of insurance. Our psychiatric emergency program, or PEP team, is a team of crisis counselors that's embedded in Sherman Hospital's emergency department. The team is comprised of crisis counselors who provide crisis intervention and psychiatric evaluation within the emergency room. The goal of PEP is to ensure appropriate level of care placements are made and effective safety planning and discharge planning as well. So that could include being discharged to the community as well as assessing for if somebody needs inpatient mental health treatment.
Can I interrupt you?
Yeah.
Sounds like a great program. Who finances this? Is this a county or the state?
With the PEP program or which program exactly?
Well, it seems like the whole, the Ecker Center.
Yeah, so our funding is through a variety of different avenues. So, for example, our mobile crisis response team is funded through a grant through the state of Illinois. So there is a mobile crisis response team for there's supposed to be one for every single area of Illinois. Um, so for example, if somebody called our crisis line and let's say they lived in Chicago, we could help them get connected to the local crisis team of the area of Chicago that they live in.
Oh, I see. Okay, okay.
Yeah.
I come from I live up in Wisconsin, and I was
Okay.
sitting on the NAMI. You've heard of
Mhm.
NAMI board for Walworth County for a
Okay.
while. So I'm very familiar with the crisis situation and how much. What's your funding? I mean, how much money does this cost? And this is a very valuable thing, but I'm sure it costs a lot of money.
Yeah, I will say that definitely operating crisis programs can definitely be expensive, which is why we receive grants through our various different funding sources, whether if that is state level or federal grants.
Mhm.
We also, with our contracts, can receive financial assistance through that, depending on the partnership, as well as receiving income through insurance, primarily Medicaid.
Yeah.
Yeah.
Okay. I'm sure you take some pressure off of these other organizations, school districts, and the police with your activity, your services, and that goes a long way in helping those organizations too.
Yeah, absolutely. And that's why us building community partnerships is so vital,
Yeah.
not just to behavioral health care, but especially crisis programming, and building those relationships with, hospitals, first responders, school districts, and other community organizations, not just to get the word out there, but also to help maybe reduce some of the stigma around utilizing services and
Oh,
support.
yeah. Yeah. Do you have programs within the school districts to sort of educate the children, the kids, the students, and so that the stigma is not strong? I mean, it's always going to have stigma on there.
Yeah, so we don't have, in terms of our crisis programming, we don't necessarily have like a specific program with a school. We can go to schools. We have relationships with the various school districts in our area, such as
Okay.
like U46, where we do presentations for the like social workers and counselors that serve those schools. We also have our ATOD program that is through our substance use department, and they provide like prevention education for like drug and alcohol use and provide like community support to maybe divert people from using substances.
Okay. Thanks. Thanks.
Yeah. And so the impact of crisis services is to hopefully reduce ER visits and hospitalizations or to reduce further hospitalizations. The way that I like to think of crisis work is, um, if somebody is going to the emergency room, let's say 4 times a year, due to their mental health, our goal is to help reduce that. That might not mean that they're going then no times at the emergency room, but maybe the goal is to then only go twice in a year instead.
Mhm.
Um, it also supports law enforcement response. We do have our team that's embedded in Elgin Police Department, as well as we have sometimes police drop people off at our crisis stabilization program. And then our mobile crisis response team can also respond to 911 calls if a 911 call center determines that
Right. Okay.
MCR is needed.
Yeah, we have a similar program up in Wisconsin, CIT, I think,
Yep.
crisis intervention. And it's the soft way of instead of a police officer coming in with a gun, this person comes in, and so it's not as threatening as normal. Anybody seeing a police officer walk up to your door, that's threatening anybody, I guess.
hmm Yeah, absolutely. And those programs can be really important to help, not just ensure an individual's safety, but again, reducing that stress on the various different entities, such as, the police department having multiple police officers show up. Maybe it's just one or two police officers showing up with a crisis counselor.
Hey,
Mhm.
Kim, I have a question about that. If you're taking questions as you go, which
Yeah,
right.
absolutely.
So I'm the city manager in Highland Park, and our fire chief is on as well. So I'm just wondering, in terms of this law enforcement joint response, do you have someone in the police department that you're getting dispatched when they get dispatched, or how exactly do you determine which calls to go on? And then my second question is, have you seen a reduction in 911 calls as a result of this joint effort?
Yeah, so with our CCSU team, we do have crisis counselors that are directly located in the Elgin Police Department. That program is not exactly 24/7. So depending on if a crisis counselor is available, they would correspond with police. However, we have built relationships, our mobile crisis response team has built relationships with the local law enforcement where sometimes we'll receive calls um, from the police departments to then go out and respond. Examples of this can also include, like, let's say someone is arrested and, while in a holding cell, they may be experiencing a mental health crisis, and the police are determining, like, does this person need to go to the hospital for their mental health crisis, or are they safe enough to remain in the holding cell until, like, their reason for being arrested is processed? And
So you're really supporting like the police social workers, I guess.
not necessarily, I mean, it's the entire police department. It's not necessarily just the social workers. We are dispatched through 911 as well. We're a part of the beginnings of the CESA implementation, as some people know it as, where mental health and first responders, mostly police, are working together. And the way that those calls work is that 911 will transfer the call to 988, and then once through that, like, triaging, the 988 will dispatch out the MCR team for that area.
Got it. Okay. Okay. Thank you.
Yeah, of course. Um, So again, like all of these types of crisis services, the whole goal is to improve access to timely behavioral health care and reduce any, like, barriers to accessing mental health services. This also helps keep individuals connected to community services, um, based through, like, follow-up, through calling the crisis line, and again, like those follow-up, like, connection to services. And so, why does this matter to the Rotary Club? Behavioral health affects workforce stability and families. Um, it also strengthens overall community safety, and it aligns with Rotary's commitment to service. Our goal, and your goal as well, is to build healthier and more resilient communities, and that's not just what behavioral health care does, but also crisis services. And how can you help? By sharing the crisis line, inviting Ecker to speak to additional groups, um, building partnerships on community initiatives with the Ecker Center, and support behavioral health advocacy and funding as well. Um, Thank you so much for your time. This is my contact information as well as the crisis line. I can also take any other additional questions as well at this time.
Well, have you gotten positive feedback from community members and leaders?
Yeah, I would say overall, we've gotten a lot of positive feedback from our crisis response, whether that's mobile crisis, the MCR team or CSP. We've continued building our relationship through the psychiatric emergency program, which Ecker Center has had for quite some time now, as well as like our CCSU team and our crisis residential program.
What are your statistics of the type of crisis that you mostly address or have to deal with?
Yeah, in terms of specific statistics, I don't have those off the top of my head. However, I would say a lot of our crises revolve around potentially someone having thoughts of ending their life, thoughts of potentially like significantly harming somebody else or experiencing like psychosis. So potentially seeing or hearing something that isn't there. I would say the other additional piece that we often serve is individuals who might be experiencing mental health challenges for the first time. So having challenges getting out of bed, those late night, like 3 a.m. thoughts that then you can't go back to sleep for, or like potentially having significant challenges with going to like work or school, depending on the given situation. Family stress, financial stress as well, homelessness.
Okay, so they're mostly personal or individual, not necessarily like violent mental health situations that are usually referred by the police or, some crisis that's happening around the streets or so.
Sometimes it can be those things. However, depending on like the level of risk and safety, we may refer to calling like local police or EMS, given the situation. Our mobile crisis response team can also co-respond with police, which whether if that's us calling the police to respond together or if the police are calling us to directly respond together.
Do you have an emphasis in age group that is mostly affected by this, like underage minors or teenagers, seniors, or people in the workforce?
Yeah, I would say for the most part, most of our services are provided to individuals between like um, 18 to probably like 65 years old. However, we serve everyone. So youth, especially teens, like experiencing mental health crisis or middle school age, experiencing a crisis for the first time. We've also worked with seniors, whether if that is people who live independently or in assisted living as well. Yeah, we can respond. We can meet with anybody and
How,
support
how
anyone.
many people work in your organization?
So in terms of Ecker Center as a whole, I believe we have about 200 employees.
Mhm.
In terms of our crisis teams, I would say we have probably about 50 staff altogether.
Mhm.
What about your caseload relative to like last year currently? Has it increased over because of economic situations, or has it remained steady, or what's your take on that?
Yeah, so I believe in a year in review, our crisis services have increased about 55% from from the year prior. However, I think part of that could be like financial crises, people potentially like losing health care. It could also be just our like word getting out there as well and people becoming more and more aware of our services. Our mobile crisis response team, that grant started in July of 2022, and then our crisis stabilization program just turned 3 years old. So some of these programs are still fairly new to the area. And so the outreach to like individuals who may want to use us or need to use crisis support is still kind of coming up.
Still developing, so you
Yeah.
don't have your figures are not over the long term right now. You're just getting started. Well, that's good. Okay.
Kim, thank you for your presentation. Are you looking to expand the service area that you're currently providing work to? I mean,
Yeah, I mean, we are always open to expanding and having those conversations. If you are interested in having a conversation, of course, like feel free to reach out and email me.
okay. All right. Appreciate that. Thanks.
Do you network or have similar centers, let's put it this way, that operate in other areas of between Lake County and McHenry or so?
Yeah, absolutely. So, for example, I know Rosecrans serves McHenry County for their like mobile crisis response team, and I believe that they are building a community or a program very similar to the our CSP program, but it's called the Living Room.
Mm-hmm.
I believe at through Lake County, it would be the Lake County Health Department.
Mm-hmm. But you do not meet like you don't have conferences among each others to compare services. Let's put it this way, like I don't know, a symposium or a fair. for
Yeah, so the state of Illinois, through UIC's Crisis Hub, they offer conferences that we attend as well as like stakeholder meetings. There are also more national conferences. I attended one this past fall with various different crisis programs that are all throughout the US.
Mhm. Okay. Well, we appreciate your presentation today, and as everybody know, it's recorded, so it will be available under the District 6440 Rotary website. And any other questions? We hit the half-hour mark here, so that's why we're losing already some people that just scheduled for the half an hour. No more questions?
No,
Okay,
not
so
from
then
here.
everybody got already the slide with Kim Kidder's contact information. Just call her, or otherwise you can refer to the website as well. Thank you very much, Kim, for your presentation. We can talk another half hour with it. It's a never-ending topic, and thank you for your help and the service that you do. That you're trying to expand even in your area.
Yeah, absolutely. And thank you so much for your time and have a wonderful rest of your day.
You're
Thank you
doing a
very
great service. Good. Keep it up.